This morning, we're going to look at factors that contributes to bad breath. And we're looking at bad oral practices, and then we'll look at the good ones as well. We'll be taking you to, the days before. But I'm in the studios with Mr. Bright Osei Frimpong from Active, dental clinic here this morning in the Yaba Butching Como. Chief Bright, good morning.
Good morning.
How are you?
I'm good, and you?
I am good. In fact, right after here, in as much as your body is bigger than mine, you need to leave the shirt here. You don't have to take it away.
I'll do that.
It's so beautiful,
Yeah.
That's okay. Young one come on straight up. It's in there, your share or your oral practices. Onyaza, most of the times, you pay so much attention to. You hear people talk about their skin. You hear people talk about their hair. You hear people talk about so many things. But when it comes to we hardly talk about them. Most often we talk about the teeth without looking at other factors. Things like conditions like halitosis. So this morning, let's bump into wet na share oral health in Ankasano. Let's look at things that come together to form that oral status, as far as the human body is concerned.
Yeah. Mechia wana oshe Max TV anopayim. Now, intro no me papa say people pay attention to the skin, even the hair. Now, the oral health ne dey on pay attention to. Ni nyina unze nipa pe de nipa hu na okafa na ho. But menu mu ne dey I can close my mouth obi ntimi hu de ekoso menu mu no. Nti say o yade kra na e say okwayi a metima kwayi na menkasa obi a ho a metima kwaba. Na emom no say meskin de mentimi mfa de nkyekere me nsa ho ana me na ho na menkwayi no. People will see it and talk about it. Na emom no say metimi akamanu atuma menkasa na makwaba me penisa. Enu nti na yemfa attention yempe attention emfa nko yen oral health no. Ye kan oral health a enya wo sene nko a say dey sika ye no. Ye fra bi periodontium. Periodontium no eye de ma wo se ejina enye mobile. Ema wo se na enwo so nse se ensese wo so.
Okay.
Ese stand firm. Say de be ya ubetimi o kasa ubetimi enya the right words.
Okay.
Ena udidi nso a ensheki ema ne nkoye wo ya. Nti ese mire bia no se ye dendenden a enwo so. Uyi no free ho a o tang no nso eka ehu bi. Wano eka ehu bi. O palate na soro ne fam no nza o se esoro ho no. Ni nyina nso eka hu bi. O minimum ho no.
They also forgot.
Eno nso eka hu bi.
Okay.
Ni nyina ka bom. Ho so ade then so say ye kase ye kyerɛkyerɛ oral health ho ade a wan hwe a ye betumi ayusu sabria kopma nwumra ye nwie. If you say if you nerves ending.
Okay.
O body ni nyina no se producer ho a owo ibi or this Sunday betimi ashu na.
Okay. All right. So if you can hear us there, one my hand the pictures of the oral, because people even believe that the sinus, in when on the part baby forms part of the oral state of human being.
You say ENT so ewo ho, throat no, ene o nose no, omo so hwe ho de.
That's right.
Na emom no, o throat no koduru ba bi no, e kan oral health no. Ena ohene ho no nso eno nso e ka ho a ansa kura no obi behu se ohene no ebia wanya halitosis na o halitosis no eye o cyanosis a e wo ohene chi ho no ena halitosis ni free ba anase e wo wanum no ehia a qualified person ansa no watimi aka kire untimi enka nkire obi se o senti amiti efri nanum ide eye ne cyanosis no na aye inflamed.
All right.
And I say a be free ni minimum.
All right.
And I say be free say e be our periodontitis bi. And I say or gingivitis bi. And now or cavity bi. And now or ne tongue no efin abaho.
Okay.
And I say or tonsil stones no ebi. And I just say o dentist na be examination. Intina de bia no kojo ya itufu say every 6 months no. nka go and see your dentist.
Okay.
Na onye examination about wanum ho no. No hu se o esin bi wo akire ha tokura bedam. Enu nti na osori ya wo se wonya kaka no. Hu se ye de wo ba ye mfam ha de obi anum ye ne yapɛ no se kaka. Obi buzam se kaka no. Kaka de me kire ne se ade bi a ekoso a edi pain e ba wanum no. Ye ne ye friend kaka. Okay. Dentistry ni ha ne free buy.
Okay.
In the terms be bro ha intimi nyama saa ya de no. Ne aka no nyina bom aye no kaka. Na mo se tokro be da usimetimi ma pain.
Okay.
To us no we will call it say yenya kaka. Se unya gingivitis ana o gingiva no eno ana ogam no.
Okay.
Se no nso ekuro ba mu a ebe ye oya. Eno nso nipa no be ka say wanya.
So the layman say oya kaka.
Yeah, oya kaka. Se o sikra wo so a eye mmoba isan say o periodontium no ho aka ni nti no ho no the moment I was be wo so pe no e be start say eye wo ya.
Okay.
Eno nso obeka kire say nipa no be ka say o kaka.
Okay.
Nti ade bia ko yanum eye ya na fa no say kaka.
Okay.
Nti e ba ye oral health na esun yie pa.
All right.
Nti enne no me dia di say benya time pa na
yetumi yezum. So let's look at enum kanara. Yenhwe nzama ye ya oma nyimpa yenenum obanka. People have been complaining. We're hearing so many things, but in the yendi code one, the myth, the realities, and you know all that. Inti fayen from one. Obi say what's the pro one no numban. Obi say inchucho wota chamadia no numban. Obi say wutsimi bekra no numban. So this oral hygiene, take us through the steps one after the other, so we can learn today.
Let's start from the cleaning.
All right.
Say one you cleaning. Cleaning is a oko anya o normal brushing na o sorry anope o brush here no anya no na ye ka ho asem do enu ye cleaning there, but that is the home remedy a wa wo ye etufu se wa wo ye na emum no o brush na o use ni fie no entimi enhohoro wanum nyina enwie, even though say udidi wi a etufu se fansuo gina wanum, that is the rinsing na pigu afen so flossing is say can it na the air say obi kura prayer da baby anu atu no abu na atete anu no de yinisim eno no one we abetimi anya gingivitis.
So it's not a good practice.
Yeah.
Yeah, it is a real world restaurant and other yakochoba num nazi after eating we take the toothpick and then we begin to remove damn particles of food in our mouth. You're telling us that it's a bad practice.
It's a bad practice. I say ye jai. So ye bia mesel say jai. They say no the tufu say ahoma biaba. Ahoma ba flosser ote na wa wo de aye eno no entimi cause any cut e wo wanum enti eno ho ne tufu se if is eno no koya nti obi wo ha o yiyi no na ebi ade no bi akɔhye baabi na o try say obeyi bon say o hete the gingiva no o yi ne se bon say nanum nyina yi moja onim say normal ekuro eti say wo de ade wo skin no.
Okay.
Ekuro na o create ade ama wo ho enti no ye be se wo ta ye bia jai fatu hansa.
Okay.
Oye o flosse na o rinse wi a still no stubborn ones bi o ha e ba akɔhyehyɛ we frɛ bibi interdental spaces e wo anum o symptom no e bi e kɔhyehyɛ ho a after 24 hours no na e harden na emu na bacteria no e betena e de fight against ose no enamel na e kata ose ho no ye kan enamel make us no the fufuo na wani ehu no, that is the enamel. Okay. That is the outer layer of the tooth.
I wish we could get pictures of it on our screens this morning so that viewers at home can see exactly what we are talking about. This morning we're dealing with oral health and Dr. Bright Osei Frimpong. Dr. Yanko.
And the wani hu no, eno na ye enamel no.
Okay.
Ufri enamel na, ye frɛ bibi dentin.
All right.
Ufri dentin na wako the center of the tooth, that is the pulp. And the enamel no nyame nyansem no contain any active ingredient bia inactive because e wo ho se wonum ade a share emma enkoka dentin no ma ne nya wo ya ana wokonum ade a enyu pa enkoka dentin no emma no enya wo ya ena afi so wo ka dompemu a nse nyame nyansa ese minya ade a de betimi abodompem nti enamel na djuma eye no na esan se din nti no Emoa no omo finding it very difficult to penetrate through the NML.
All right.
It did there obey and say okay any ma mempe edan bi a ebensen no. Na mentena ho. Na ayese yafa wadwuma na ote he ya. Se breaking news bi ba 12 gra. Ezan say room wa ha nti no obetimi aba ba ye. Na emo bi a ote adenta na wo ba. Wan hwe a wo say wo ba adwuma no bre. Enti plug na ebeta esen no ho no. Onya ekwohye no mu a oye adwuma 24/7 politician make 24-hour economy. Enti osore anwumra o tu sinum o penetrate e tutokro e wo sinum se de be ya obetimi awura akodantin num akopop num akodidie ewo mu no. Eno na ye na duane.
Okay.
Enti se ede na abaye ene ma onanye ntientia na sa fi na beta ase no ho no. I mean, called the dentist or not only say feeling free.
But does that one produce any odor in the mouth? Because that is what we're looking at today. Aside we're going to see the dentist, what effect does it have?
Plug no. So did you have say plug no say okona dentist a white to ho. Na ode onsa sum ko ohene a. Obeti de ye kan you will get a clear picture of what I'm trying to portray.
Okay.
Ade a eyi nka pa.
Okay.
Enti ade ba ko ade enka ba yanum pa eye obi a onye cleaning. Enti da bia ye tonchia se yawo wenya 25 years, 18 years, 30 years na onye cleaning da eye likely say o halitosis. Na bia we call something nose adaptation. Ne atie ne se sade ben ohune bebre a ebe kakra no ohune ntimi recognize sa scent no.
Okay.
Itina se scent wo obi ho a ordinam na ogu ne ho animu aseko na onu ankasa enim.
Okay.
Ehune no afa scent no ayese enim no.
Okay.
Nti wo a wo de ho no onte.
Okay.
Ntina da bia metwamfo ni bi se okoto okọ bo ba bia tunregu a. Obekọ na de ogigi ska no na wanu aduane bi wa mamu na odi
why are you used to the smell?
All right. Obedi aduane nyina wi.
Okay.
Enti plug na de se wonye cleaning ni bia likely say ubenya halitosis ni bi yemfa no nto nche.
Great.
Se cavity ebeda usimu a cavity ni tokura ebeda usimu or caries. Se tokuro beda usimu a eno so likely say ubetimi anya halitosis. Na eno so de bani nse tokuro udidi every day. Esa se tokuro da sinum na ense se da ho ntino aduane na udi no na ebi akohihye ta tokuro no. Obi e de ekohye mu 5 years ni. Wa hwe se enura na udi fufuo na ebi a wantimi ani.
Okay.
Ena esa nerve ending na meka ho asem no. Uze ye honam akwa ni nyina no dodo na no ebe wie ya anum.
Okay.
Enti obi your cardiovascular diseases wo ho. Akomayade dodo na ebi wo ho ane faraba ejina yanum a yeninini.
Wow.
Diabetes obi akone diabetes no unkom no na ne faraba wo nanum a oninini.
Okay.
Obi wo rheumatic disease na poso yade. Any nkaya eda TV nso a uhu no. Enti mesre se yenhye we se menkase wo sa yare ni bia ensan se wuntwitwiri osin yi ntia na emom ebetimi ede oha no aba wanwa obeko an until se obeso anu afiri baabi no awanum ho ase obema na hia no wanwa a ebeko na basa every day na eko ebasa. Enti se wo sa yare na mesre se ma osinu nso hu enhia emenhwade ni nyina nse hwehwemu a abrofo no eyeye no de aboa na ote plug a ye ka ho asem no ye ko hu bi wo obi a wo akomayade sa ni stream ni blood stream no ye ko hu bi ewum.
Okay.
Aje se nanum no wan ni to the extent say moa wa na wo nanum no etimi anante afiri ho akona koma ho a ha na koma.
Okay.
Ema ode akomayade ban.
Okay.
Ni ye kan nyina no se wo fona se opese o jitum na make sure say yeah wa betimi afa no research about it.
Okay, let's look at the other factors because we've dwelt so much on the teeth, which we know or we've been educated this morning by you. That say to me, I'm showing any CA is banashi shave nom naza and flash nom naza. It is going to create a problem.
Yeah.
But there are other brothers and sisters in our mouth, and let's look at how they also, with bad practices, contribute to enumenka, like the tongue and the other area that you mentioned.
Let's come to the tongue.
Okay.
Say u twitwire osia. Mesel say twitwire osin so. Brushes are you use no fie no. Say o dane akira, baby a Bristol no one. We say ho no aye rough bisa. Eni ho say for fun.
Okay.
Utimi dan no ye wo tongue cleaner ho a e bia na oni bi.
Okay.
No ko dental clinics na omoton bi ubetimi akọ.
Okay.
Na wakoto bi.
Okay.
Sa tongue cleaner no.
Okay.
Eno no ubetwitwire osia, wo di clean tongue no. Obi o ha ohu ne se fita cavity bia ni ne sim enso na o halitosis unkom no na ye ne techere maso fia onim kura se wutwitwire osia etwitwire ya techere maso.
Okay.
Enti ano so de efin ba ye fra bi tonsil stones tonsil no obia ewo bi eno na emoamo wa ekoye mu no na dwuma ne se aduane be fa ho na akonti no wo ochi dodo na se de be ya entimi nko duru anum.
Okay.
Adwuma tonsil no eye no na esa adwuma so eye nti no eto da bi esa chifin na ahadin fin ni bi etata ne ho na ye stones. That is why we call it tonsil stones.
Okay.
Eno no se wo fie na ba wanum wide pa utimi ehu se ade white bi
white bi so tetramado
ade a se bi to fam na ofa udidi afa chen wa hwe aduane a udi nyina na ebesa wanum nti obi nso techere ma na otwitwi nanum odinini nanso san eno no nti no de halitosis abananum eno no wo fi a ye wo home remedy wo ha etimi ekire.
Great. Insomnia by and then
O de nsu hie kakra de nche kakra guma na wagago o de gu wanum a na ayese de o fe no
azibina ye no
ya etimi ewai bi.
Okay.
Se enya de a ache bebre a etimi efiri ho.
Okay.
Na emom no se wo ye na anko a kona ko hu dentist.
Okay.
Ono so betimi ayini nyina afro within few minutes.
Okay.
Na wawie e de amount.
Okay.
Enti se wo se ya bo no ma be num so.
That's right.
Enti yemfa ho ntu amanfo wo se obi wo ha otise ye to aduro obi atia na so halitosis. Obi to aduro ba bi na wakoto.
Okay.
Na wanom. Ye hwe se utachere maso na afi. E na de enumka na eba na wonum aduro. It
doesn't clean the tongue.
It can't. Because a non-yet problem.
So you are doing so much, but
yeah.
Okay, so stones in Erica was some all right.
Oh, dear, touch the man.
That's right.
And one who's saying, Ubi see a good when yet Ubi na draw you. And you'll be seeing Casa.
That's right.
And now I could do this level now. Say any power, say only net Tifina or Casaguswa. Who's our head to the wa? I dear Bishaho. And yet seeing the sea Sir, tonsil stones na ye kan ho asem
on a wire damina
ana ebi akosha ho sa
ahwefo won fan chan ne yo yehu kakra bia na ne penya breakfast pepper bi na reason mama mbo wonu facing chan ye hwewi a na sanso ekokezi waze but we no ehwe techrema no da onya yareba bi na wa ma wa
techrema no uze ye kasa ye ntimi ye because ye mfoni ntin ye nsisu dia but ebetimi ayese ebia oral cancer kra na ebobo eba no.
Wow.
Okay, techrema no so a uze aye krona aye inflamed.
Yeah.
It could be a betimi aye nti eno no se uwo bi amese entoto na ase se ukọ dental clinics and a hospital na kojo obi anya periodontitis na ye bie nanum a kire wa anhwe a obedwane.
Wow.
Obi dia ye wears a obi se no ama untimi nsevu not a tooth. I just say uyi ni nyina afiri ho ne sini nyina asai.
Wow.
E shaase afiri gingivitis. Unta me kan bibi periodontium. Eno ye kan ye de si ho a periodontium no ne ekura sen no. Within the periodontium no ye fra bibi periodontal ligaments.
Okay.
Ye wo cementum e wo ho. Ye wo alveolar bone e wo ho. Ana ye wo gingiva, that is the gum. Say anyoma nan ana mesin ejina brane a enwoso. In this one way, na a can gamma, gingivitis, not just I can't just out of the four, no, but I can aka. Into a canoe, I don't know what, or dentist bet me crack red broke a come out. ama akọ within few days nemo wotena hwa na efri gingiva na ebetumi attack the cementum
okay
akọ attack the alveolar bone
okay
esen esisi dompe so
okay
ndi se koka bone na wa hwe yi a na surgery a doctor no be ye no ebeteki usika na teki umre na wa hwe a say di udem if say ekoduru sa periodontal disease na ne kono untimi reverse back
wow
esen a etu na wie nti mestre say oh na osen obi wa ne sen no o de ay calendar oh month bia ne hono pai eno abeko o man madu kra eno abeko
okay
bo wonka ye say
there is something
there
do.
So go and talk to your dentist.
Okay, one of the things me pede share na when we touch on that, we would go and then find out from viewers and also another Ghanaians binuma yanyuanzin come concerning today na henesa hu na henenuma sam so wacha wanadwin fa, but it has to do with brushing of the teeth. What I'm asking as a lay person you there, is it just about yaze edu yazer to toothbrush no do the toothpaste yazer to brush no do na ye chuchuara another when it comes to toothpaste in the there is something we need to watch out for. Obviously fluoride no it should be this and all that. Even the brushing other techniques are to take away in zamanzamo the number of times we brush them and then take us back a little. So give us that education this morning.
Yesu sano. Na technology nru de yadru e as ade a ho ne se yadru baabi na onko a wo twen ho afri level a yadru no na opese wo the olden way of doing things.
Nature does not seem to accept it kinda.
Enti na de anim ye body tray. Body tray no na ye de jebidie that's charcoal atum. Na charcoal no ena na paste. Body tray no ena brush
at the time
yenya gingivitis a na o ma me akọ phantom ago na wa hye o hye a no de ahye wanu o se kwa no tum hye na no ene chako na ewu mu no na a cleaning amount ene no ya drum pempenso a ya anioma bebre ni akabo ma ye no wana se wo twitwire osin a ebo ho ban afri gingivitis ho ebo ho ban afri plaque formation ho na abo ho ban afri cavity ho na sa abo ho ban afri halitosis bad breath ho ene no se wo koto paste e se obi wo ha de ehia no nanum se e se mesin efita enti ene ye se charcoal biaba that is the activated charcoal enti okoto me nka se ne we are not here say obi adwuma
okay
activated charcoal the enim ni say dodo na no fluoride enim fluoride no de eye wanum ni say eno na bo o enamel no ho ban say o enamel no ye weaker ubenya sensitivity ubetumi anya yellowish teeth yenti ate say say charcoal highly abrasive po o enamel no po enamel na ehi no ena from the NML uko dentin obia se color no ne dentin no ne true
okay
se wo strong NML o sentimi ye fita isan se edum NML no color no
okay
de me example ha unse table esi animu ase ne brown ena soro no eva se no na ye NML no isan se ewo big coat ndi no unhu baby a white no unhu brown adum no na emom se yakofa entoma bi a emu ye hata be kata table iso as still be hu se ade na wachire no
or show
brown then tin no yellow enti no you need a strong enamel se ebedum sa na yellowish no na wanya whitish teeth enti yakonse nyina no omo koto ni nyina se o yesi udi twitwire osin a
ema osin ye
fita ni wura fi se osin no betimi aye fita kakra na emum no ebetimi ama wanya receding gum and enamel uze abrasive ninti no etimi ma o gum no ewe no
upper is that what you're trying to say
ehino
Okay.
ehisin no
Okay.
nim se mfante se
Nanyen yanko.
Enti obi wa ne kasa ohwe ne se ase a bo se esene root no esisi ho.
Okay.
Gam ni nyina ayi afri ho.
Okay.
Obi o te se bia likely say o sensitivity. Ana obi o te se bia no enche wo se no ebetimi atu.
Is it as a result of in the toothpaste I bought yesterday, there is charcoal, there is black.
Yeah.
Is that what you're telling us?
Yeah, and then the kind of brush you use. Who's that? Obi ekoto brush opede Bristol no. Ano edin.
Oh no, to me fisini bia.
O say no ti say dey sebe. Who's na Ghana mountain di no. Me coach local na kakra. Say dey odi twi waduro mu no. There be. Enti na yesi twitwi osia no pa na twitwi anwumre. Say o brush no emre say den a o follow this protocol o say no ebenya hoodin a.
Wonum so nka be ye.
So
you're saying that the hard bristles are not too good for oral health?
Never. Entinga okra no nga okoto brush a esa o dentist and recommend man say we ebeboa we emwa. Entino okoto brush a onko dentist hoi mesro say enko nkoto brush a ano din obi twi ne se a ugina ase ho a obeti se obi twi ne se.
It is not how hard you brush
no,
it. So what
never.
is the technique in brushing?
Yeah, you go school you try circle 360. 360 no. Uchemu a wo via as a 180 mebo a. Usa chemu a 90. Inti said you obesi position wo se no. Esanka the brush eba. Nanka ye pe domini bi.
Okay.
Okay,
but let's see if we can use what we have on the screen to demonstrate it.
And what we said here, what place a sorodian first one 45.
Okay.
And our said there was your position, that's the 45. And the Osisana and Comasi a cost circular a cost circular and say spaces be on or sending term, that's the interdental spaces. Ese efia hye ho no etimi yibie but so what fast to say ya ebeyi sin anim no pe but entimi nwura sin to sa tokro ntentem no enyi fia ehyentem.
Okay.
Ana wokọ udodom no so a won ba bi a se de what place no ho no your friend the occlusal area ho no ye de ewese ade wo se ho no aye se groove. Nyaminya nsem no ehọ nya flat a groove in nature. Say the be ya what tear ade with the incisor and then you push it there.
Then wa korea ma.
No akoria ma na wa swallow. Esa adwumaso a ehọ na cavity ta topa. Na ho so na to a wan hwe a wunhu. Enti sa ba bi ehọ na groove no. When the cavity bi ewo ho nom. Enti obi o ha onim se ehọ no ye o card ya wo se me bite ade a eye me ya. But me hwe me sina hwe ni ho nkom na cavity da ho unim enti ho no ye wo se de yesi twitwire no obu a enchen no pani hia no ontwitwire soro no ba bi ho an groove no e se wo de brush no ko na wa se de yesi position brush no wo de twitwire akire no na wa be twitwire soro no, that's the occlusal area no ansa na wa ba nimu no kura na wa be twitwire ho no nso e na incisors no enso wa se de wa place no.
Okay.
And also,
so that is the fourth picture. Now, so the fifth picture, we have the one up, the second one, three. There will be a so the fourth one.
The fourth one. Who's there? And only a asiano.
Okay.
That's the lower one. And also, what pejam. Idea ni nyina say, esa breast no timi raw sentem ho.
Okay.
Bibi hye ho. Na ho no san say, enya ko hye ho na wan twitwira within after 24 hours and ebe harden abe plug into no say o try all means in as we wie bibia akra no floss na reduce no.
Okay.
Enti after 6 months no na we ye no kakra bi kaya eno no agya ma the a professional person to deal with it.
Okay.
That's the cleaning.
Okay.
Na wako na we cleaning at the amount.
Okay.
Flossing ni bi and da ho nze nipa no when you su dua o share the right na uze obi okuta homa waso ha
okay
na ode koba sa
is it a special layer na then na ye botumi afa homa ofie na
wa there ya wa homa ya oko dental clinics ni bia you fit be xylitol ahoma ni bi o ha xylitol wo ho xylitol na it is sugar na eku bacteria Enti said you wadi sugar, usa sugar attract more no bounce ho bese no.
Okay.
Enti yaye xylitol no, et say sugar.
Okay.
Udia et say the sugar no. Enti mo anu nim say when you sugar bedi, obenza oba ho ana akuno.
Oh.
I say krama no ma na bese no. Obewu sezi a na chiwade na emum no sent na ekura no ntino attract no ekọ ho.
Wow.
Sa na xylitol na adwuma enti ahoma no bi ya head ye for that enye ahoma bia na obeti e de bi okra na enye hygienic a odi ko anum a enso the problem betimi aba.
All right, so we'll come back and then we'll look at say your is ben binom na za yeza yenya bad oral health. You share that with us as well. But let's go and then find out what some Ghanaians, think about oral health. We were on the street, spoke to some of them, and then okay, so I hear that video will be ready. All right, so let's find out what some Ghanaians think.
Because what did you one priest here, we really a bit now for show, which is a bit of a wire, and for olden days, chocolate name, we are near Mexico Festival. Very good, but to me, maybe also modern Ghana, so we know, president, we know what the other, or the chemicals know what this intelligence, very quick and faster, and easy. Boy, which chocolate anyway, a bit news a bit milk, but it's all right. But intelligence, for president, maybe, or make intelligence, I want to be a you say 2 times a day, that takes a now, you see, Diana, and so you sent. You Diana, ready issue, but as a person, a few or a more fra, a few or which the Jews and I'm not also. Who said I'm with a beaver? But I say, but yes, I'll put it to Mark and only say, every boy, and I did. They should you can go around apart, send to when you choose it. Okay, I did my time, and you know what I did, and I'm now a big was saying, you wait to cheat. Now, one cent and I can ask our other. Is anything I mean to be is 2 times a day?
It's a Diano, any body at me. Yes, Tano, Yamano, am I Yabu body at Tina? We are young to be never 30 years. They are not DNA, your power to send to be out to your fita. Come. If you are not dear, a yapa, and not dear. And then class will come back to be a moment.
That's quite interesting. I mean, a lot of people keep saying there, yes, and so but sometimes what I ask is, how many people in the Webenya Deje every morning they will coach a Brazil to now we see now wanyam brudum naze na warrior in say on. But it seems that whenever we talk about oral health, now you limit to be to or the teeth, and I sometimes get a bit worried about it. Let's look at it when it comes to our intake. Abrenzama through the mouth, na ya otum na ohoyen. We all know that when we eat, na ya brasha, like we've been educated this morning, is binding because it creates that smell and a bad odor in our mouth. But beyond that, are there other things that we should be watching out for?
Yenum nsumo.
Okay.
Nsu a wonnom no you need enough saliva ewanum. So we need enough saliva ewanum, that is a xerostomia.
We need a lot of them.
We go am so we need enough saliva and also ema unya halitosis, bad breath. Obu ha kakra bi na no awo dry mouth.
Okay.
Kakra bi na no awo.
Okay.
Kakra bi what is a mesra ko hu dentist. It could be say wo glands no they produce saliva no intimi and produce enough, that is at least 2 liters in a day.
Wow.
You need at least 2 liters of saliva in a day.
Wow.
To keep you going. And yet when nkwana eba e produce ema wo yam no nso no acid a ewo mu no anya sa anka o vomit a anka yes wonum nyina no essay. But saliva wo wanum no and e boa diffuse
like a cleanser.
Na ema enhaw enti numsuo mo afen so no obi wo ha okodi okbeda no amfa bibia anto nanum ana ompekura wadidi awie bia odidi 5 o'clock anado na owura dem no oba kote nam kakra awe owia wakoda odi tofi betu nanum owia wakoda hu ze tofi no bebre sugar ana ewom udi eko akoda no wamamwa no wamam light se omumfa
where's bronya
wadi bronya obese wo sene sese ya idima se the moment a obe paste awie obetwitwi wo se anumra awie no anyway ene se wo zali toni bi dia ye woni gam e wo ho obetimi awe bi na odi akoda eno ye betimi aboa ena udidi adidi yie ye bese se udidi a didi obi ha dompa edane nam so no onwi ni nyina aduana a wato no aboka enti dompa den pa esenka ode to ho ma se kraman kra ne be fa da bi obetra ya abu dompe no akoyi die hye inside no atafre kete no nam kakraka na oto ni nyina no anso no dompe kete die hye mu no obese ode ne se akoyi saa de no na odi uyi no firi ho a obi ko party a the odi show say nani abie onimnyansa ne se oje o mineral another one say cook
or
drink oje a no de ne se no atu na wa odi amount no atu no de amount o me de mesin edin o yesa ni nyina no one day o se ebetimi akrake a ede how ebetimi aba aside that no ye be say udidi wi a aduane a obedi bia no make sure say we de ekoka wanum nyina apie
okay
ansa na wobekọ a wako na se ne yesi twitwiri yesi na ye de beto so no one day ye beba ha na
well, better demonstrate me what's that, man. Yeah, boy, telephone lines into whilst we're having these conversations now. Yeah, sure there's so be war as in BCB na there or experience be up there on your chair in the year share the oral health. That is what we're looking at, of course. The world all over, that is what we're celebrating. It's Yana Messenger 0558-462-088. It is on your screens 0558-462-088. Wapacho se freyana na television no abombozna edubno amahen na yetum na yezin komo I mean the volume, sorry, now my volume nuko form na yetum na yezin komo papa. We're looking at oral health na yesho kwana yaba for the yaba brush yene teeth very well. Dr. Nyan Afembebre, you know, what trying there hente chama kwana yefa do yechuchu do it's one of the ways that yabo na yetum yezi yene numinyi nomnaze. So you can also join our conversation this morning by calling the numbers on your screens na yentum yenzi in komo. Doc, let me come back to you now and share the Asian practices nibia ya twachna edges there. We need to go back to it.
So the medi kind.
But Pachami, I think we have a caller on the line. Yeah, Raphael, good morning. Raphael, good morning. All right, Raphael, someone can you my want to pay.
Morning.
All right, let's hear you, Raphael. Okay, so
good morning.
Raphael, yeah, we can hear you, Yanko.
Okay, this model, only
Raphael, your line is a bit bad. And so if you can position yourself well so we can hear you well. What's American or and papa, but try positioning yourself now to be. And so you can also join our conversation this morning. Minyimza from Biana in Kebi, at in Kebi. I'm not too sure whether it's a permanent thing another or a bar if it's something that needs much attention. You call us this morning, share with us. Na Dr. Waha Untum Nombo. But let's touch quickly on the Asian practices that you think we should not abandon.
The number di kan unse na me yese baby a yeduro no enoma bibra bidie na idea na ma ye use bidie no unse bidie na wo ka obi kura na yɛtumi de bidie ehili nipa no sɛ mframa gyina wo yam na sɛbe woyi mframa a ɛno nso bidie wɔ
a role to play in it.
yeah ɛtumi ɛma ɛkɔ fam o cholesterol ɛkɔ soro a ɛno nso ɛtumi boa ɛma ne kɔ fam ɛna wo sɛ obi yɛ nkwan koraa na ɛsɛe a ɔde bidie tum a
Oye, baby. Okay, sorry. Akwesi Mensa from Ashaman is on the line. Akwesi, good morning.
Good morning, boss.
Yes, sir. Akwesi Mensa want to pay.
Pacho, I am not sure my gonna be so. Pacho, obi didi we nese or no drink and pacho sugar. Nese one piece no kwada ebe hard one.
Okay. Kwesi Doc would answer that. I wish there I have an answer for you, but that is not my field. It's once Doctor is here, Obutu no answer. You heard him.
Yeah, advice is nom drink nakoda. Ubetimi enya sa cavity a ye ka ho asem 2 decay no ubetimi enya bi. Intino say oh nom drink na dia paste ansa na wakoda.
Okay.
Na wayi sa de beka wanu ni nyina afiri ho. And nom drink sugar bebre wom. Unum wie koda na etoa so a wo se no tokruba ba didam ebedam a beduru ba bi na ese esen yetu ana enoa ebetu
Okay.
nti o hwe yen enne na wotae a enye kwasi mensa nko ana ebusa wotae bi a mesa se jai discontinue onye bi na u koda de a na wa paste awi a ode koda wa floss wa rinse na wa paste na wa koda unze wo sori anopa no na wa ani hwe wo ye we wa ani hwe na akoda wo sori a tunze wanum no kama yie pa aha edi eno de utie ya.
Okay, Akos wa ha me fa Akos. Akos, good morning.
Good morning.
All right, Akos my yente want to pay.
Mama ta.
Yeah.
Me ba me single phone you know what for mama. But I say
No, we are listening, Akos.
the simple phone you know what for mama. So close the house o kwa na ba me na for them some my people. There's one na ba e for you say ya ba o kwa na.
Now, Akos, what did saying?
It's what
I was saying
13.
13. All right. Thank you. So, Dr. Osei Frimpong would address that for us this morning. It's
oba eswapa na ne milk teeth no entutui na wo na tokro bedam ya yen hasen no bebre.
Okay.
Enti bia o ka se all corner bia na osua no na ode na ekote say from 13 years e kono de say e betimi tackle sa esen na ayesa no enti onsa mfa no nko ba bia ode ne ko ya na onpe dental clinic bi na onfa no enko say de wanyi a we can deal with that particular tooth.
Okay.
Say a milk teeth and I said the temporal teeth na eba na tutu no de e betu dada enti say nya severe problem bia na aba sinu a ye jai no
Nanara way to but you see, one challenge I hear on our markets, and I want you to really deal with this one extensively for me. Yenu Guadono in the toothpaste, why baby? You would help us know what we need to look out for to ensure that we have good oral health. But Sisi from Kaswa is on the line. Sisi, good morning. Hello, Sisi.
Hello, good morning.
Good morning, Sisi. Mayete Wadepe.
I know more can halitosis asam. What to me likely said, oh, see, you talk with some or no. I don't know about me, halitosis no.